Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business this Tuesday. We like to talk about some things happening in the healthcare front, technology front, kind of some of the cutting-edge stuff with Kent Batman every week. We do it on Tuesday. Kent, welcome to the program, as always. I do want to mention your good friends over at Vichem Eco Fluids. That's Vichem, V-I-C-H-E-M, Eco, E-C-O, fluids.com. And innovators in coming up with green approaches to both the environment and to the wallet when it comes to providing drilling solutions. And welcome, Kent.
Well, thanks, Kev. Great to be here.
Glad to have you. And you got a great guest for us today that I heard so much about from you in the last week. Looking forward to learning more about him. Go ahead and introduce.
Yep. Dr. John Thomas is an internal medicine doctor specializing in wound care. He's going to tell us a little bit about what he's got going on. Dr. Thomas?
Very cool. Welcome to the program, Dr. Thomas. Before you get into wound care, tell us a little bit about your practice.
Well, I specialize in wound care. I was internal medicine for quite a while, worked as a hospitalist, and in doing that, I realized there was a real shortcoming in the medical community in wound care, that it wasn't a area that was really being attended to. And so I started specializing in that because I saw so many patients that had chronic wounds that were not being healed and coming back through the system repeatedly, never being healed. And that just called to me, and so I started working in that field and have just specialized in that ever since.
Awesome. Kent, go ahead.
Well, very good. And I understand, Doctor, you are, I think, expanding. Is that correct?
Yes, I've started a very unique program here in Houston where I actually have a continuum of care. That is a buzzword that's used all through medicine, but it's not something that we really see very often. And I've created a system where when I have a patient with a chronic wound that is introduced to me, I will manage their care from the hospital into a long-term acute care hospital, into a skilled nursing facility or home health care agency or outpatient wound center. No matter where they traverse through the healthcare system, I'll continue to follow that patient and take care of that wound until we have it healed out, which is a very unique concept.
How big a role is diabetes playing in this situation?
Diabetes plays a really large role in the outpatient area. We see a lot of diabetic foot ulcers. We get a lot of amputations due to end-stage diabetes. This is one of the areas that I'm really branching into now. I'm getting ready to launch a whole new program on limb salvage. What we found is that approximately 70% of the limbs that are being amputated currently are not necessarily needing to be amputated. They're being amputated because there's a lack of understanding information in how to heal some of these chronic wounds. And as we see this happening, we're having more and more people getting amputated, and we're trying to create a program now where we can stop that. So that's one of the big pushes that I have on in Houston right now.
Kent?
Very good. Yeah, you had mentioned that you get patients all the time that come in and are maybe told that they're about to be amputated, but you have had many situations where you save those limbs. Talk about that.
Yeah, there's quite a few instances where people have had orders for amputation, and they or a loved one has reached out to me and asked me to intervene. And we take a look at them and find that there's no real reason to amputate the limb other than the resources and the information to actually heal the wound that's on that limb is not available to those physicians in those areas. And wound care is a evolving science, and it's really exciting time right now where we're just really expanding, and we're able to heal things that they've never been able to heal before. And so what we find is as long as we have adequate blood flow and I can get the nutrition up, we can pretty much heal anything on the body. And that's the difference between now and a few years ago, where we just didn't have that knowledge of how to heal wounds. And so a physician would look at a wound and it would be very severe, and without the knowledge of how to heal it, the only alternative at that point was to amputate. And what we're trying to do now is spread the word that we don't have to amputate anymore, that we're here to help salvage limbs. The cost to society, to the person, to amputate a limb is enormous. And if we can just correct that patient flow right now, I think this will be a substantial program for Houston.
So give that number again, the percentage of limbs that are amputated unnecessarily.
Well, there was a study that came out that showed approximately 70% of the limbs that are being amputated do not need to be amputated. And of that 70%, another study came out and showed that 50% of those limbs never had any vascular workup done at all prior to amputation. And what we're finding is when patients come to us, we'll do the workup, which unfortunately has usually not been done before, and we find some vascular flow problems, and we can correct those on most cases. And once we correct that, we can pretty much heal up any type of injury or wound to that leg.
Wow, that's incredible. That's incredible. And it's surprising when I look back over my life how many people I've known who either have had amputations or I've heard from, they've had a loved one or whatever. And now when you hear those kind of numbers, it's like, wow, was it necessary?
Yeah.
Well, considering the time and generations past, that was where we were. And those were the things that had to happen. And medicine constantly evolves and constantly improves. And that's the great thing about today's technologies is that we have now information and understanding and how to prevent these types of things that we didn't have in the past. And so it's just an exciting time to live. The technologies that are coming about all the time are phenomenal. One of the biggest things that I have to deal with is infected wounds. And there's some new technology out being presented by NextGen that it creates a system where they can sterilize the air and sterilize rooms and decrease infections, which I think will make a phenomenal impact in wound care.
Yeah, I'm very familiar with that. Kent's talked a lot about that, and it is very cutting edge. It's very exciting, actually.
I think it'll make a great impact in wound care because a lot of what we deal with are surgical infections that create chronic wounds. Diabetic wounds that become infected and become chronic wounds. And once a wound becomes chronic, then it's more difficult to heal. And certainly if we can decrease the infection rate, that'll make a huge impact in this.
Ken Batman, he's here every week. He, of course, does our weekly segment that we're covering here today. Learn more about him at VicamEcoFluids.com and his company. And our guest today, Dr. John Thomas, fascinating topic. Dr. Thomas, you have a website where people can go and get more information?
We have a website for the limb salvage program. It's called limbrescue.com. limbrescue.com. What a neat concept. Really well needed, and throughout medical history, there's always been these paradigm shifts that have taken place. And unfortunately, they're sometimes slow. But this sounds like a significant one that can dramatically make the difference in the lives of others. So thanks for sharing it with us. Well, thank you for taking time to talk to me.
You bet. When we come back, we're going to have much more for you. Do want to remind you, best content here shows up over there at usdailyreview.com. While there, like it on Facebook, follow it on Twitter. You're listening to The Price of Business.